Let's talk about the vaccine. There are two types of vaccine, and I'll talk about those specifically in a second. But the governing board that governs all vaccine recommendations in the U.S., which is called the ACIP, and it stands for the Advisory Committee of Immunization Practice, has recommended vaccine of girls at 11 to 12 years of age. Anything that falls outside of that is called a catch-up vaccine, which is why, because if you haven't gotten it when they say you should get it, then it counts as needing to catch up on it. And so for ages 13 through 26, they're recommending catching up on it if you haven't gotten it already. Let's say you're gung-ho about getting it when you're 11, and then you hear something on the news about how if you get the vaccine your head's going to fall off, and you decide not to get it, and then the next year you decide that that was a crazy report and you want to finish it. You don't have to restart. Once you've started, you can keep going, and we'll talk about what that means. The reason it's important, I think, to talk to somebody you trust about it, your doctor's office, listen to what they have to say. I don't give it to every 11-year-old, but I talk to every 11-year-old and their mother about it. If we decide together that, as we all know, there are different levels of maturity of 11, 12, 13, 14, 15, 16-year-olds. Some parents come in and teens and they're ready to get it at age 11, and that's great. Some come in and you mention the word sex and they look at you like you have four heads, like they've almost never even heard of that. And so there's a great difference. And for girls who are not at that point yet, I think it's totally reasonable to wait. But I do encourage getting it in middle school because of what we know is going to happen down the road. And we know that we're not going to be the first ones to know about it, and that we want to be sure that all three of those vaccines are given before that first sexual encounter ever happens. It's worth thinking about and talking about with whoever provides you with your vaccines to figure out when the right time is. But unfortunately, that time is earlier than what we would like it to be. But it is important to get it done in advance.